stop and think about this for a moment. Nearly 13% of American women in this country are diagnosed with breast cancer. That's 1 out of 8 women. Hello, everyone. Welcome to Comcast Newmakers. I'm Robert Trainum. As always, thank you very much for joining us. My guest this hour is Congresswoman Debbie Wasserman Schultz, Democrat from Florida. Congresswoman, welcome.
Thank you.
Startling statistics. 1 out of 8 women in this country are diagnosed with breast cancer. I know this is near and dear to your heart as a survivor.
It is. It's very personal, and particularly because not only does everyone in America know someone who had breast cancer, but everyone in America, we're at the stage, knows someone close to them who's had breast cancer. And particularly my focus has been in sharing my own personal story with breast cancer. My focus was to make sure that we could raise awareness and educate younger women about their risks and make sure that they focus on their breast health.
You know, oftentimes, and I'm stereotyping, but most women probably think that breast cancer, God forbid if it does happen to them, would happen later on in their life, in their 40s or 50s or 60s. Most American women, or most women in general, probably do not think about this in their 20s or 30s, no?
No, you're absolutely right. I mean, just using myself as an example, I always knew there was a chance, but I just never thought it would be me. And that's how, you know, millions of young women think. We're trained to focus on 40, and so I sponsored legislation called the EARLY Act, the Education and Awareness Requires Learning Young Act, to create a national education and awareness campaign focused on making sure that young women understand what their risks are, not to make them obsess or get them too focused on it, but make sure that they pay attention throughout their lives to their breast health so that they know what's normal for them, so that they can tell when something feels different.
And what specifically does your bill do? Does it raise awareness through a public ad campaign?
It does.
And what else?
It creates a national education campaign with $9 million a year for 5 years, focused at the Centers for Disease Control. But in addition to educating young women through materials and new media and reaching younger women in a format that they can access the information, it also educates healthcare professionals, because too often healthcare professionals dismiss young women when they come in with a problem with their breast, saying, "Young women, you're a young woman, it's probably not breast cancer, come back in 6 months." And breast cancer in young women, Robert, is often diagnosed at a later stage and is more aggressive. And we need to make sure that our mortality rate, which has not gone down at the same rate as older women has, starts to come down.
Congresswoman, you mentioned a few moments ago, I think right before the show, that 8 women die every day of breast cancer?
8 women under 45 in this country die every day. 25,000 women a year who are under 45 are diagnosed with breast cancer in this country. And so the disease that most people think is something for older women to worry about does affect younger women. It's only about 10% of the cases, but if it happens to you, it doesn't matter what percentage of the cases it is. It's incredibly important. And the last piece of the legislation focuses on making sure that we have grant funding available to organizations that help young women deal with the unique challenges that we face with breast cancer, because it's a very different stage of life when you're 55 and you're diagnosed than when you're 35 and you don't even have a boyfriend and you're faced with dealing with your fertility in the future. What are you going to do if you have a mastectomy and you're not going to breastfeed children in the future? So there's a lot of challenges that young women face that older women don't.
And we should also know for our viewers out there and your constituents that this bill is bipartisan. This offers both Republican and Democratic support.
It had 375 bipartisan co-sponsors, the entire leadership of both sides of the aisle in the House, 35 co-sponsors in the Senate, and it became law on March 23rd of this year, 1 year to the day that I introduced it and shared my own personal story as part of the health care reform legislation when President Obama signed that.
And where can women get more information if they need or want more information about specifically this bill, but also about breast cancer in general?
Women can get more information about the EARLY Act at my webpage. We have an EARLY Act section of our website. It's house.gov/Wasserman Schultz.
And we have that on the screen right now.
Wonderful. And they can also reach out to the Young Survival Coalition, which is an organization that is specifically dedicated to helping young women who are diagnosed with breast cancer or who may be at higher risk.
We have about 20 seconds left. Is there such a thing as being too young? Should a woman at the age of 18 or 19, should they be thinking about this as well?
There's no such thing as being too young, but what young women need to make sure they do is focus on their breast health throughout their lives.
Thank you very much.
Thank you.
And that's it for this edition of Comcast Newsmakers. I'm Robert Trainum. As always, thanks for joining us. We'll see you next time.